How is my lung cancer diagnosis confirmed after a biopsy? Getting a lung cancer diagnosis is a big step, and understanding what happens after a biopsy can help ease your mind. Once a biopsy is performed, the tissue sample collected from your lung or nearby lymph nodes is sent to a laboratory. There, a pathologist carefully examines it under a microscope to look for cancer cells. This microscopic analysis confirms whether cancer is present and helps identify the specific type of lung cancer, such as non-small cell or small cell lung cancer. Knowing the exact type is crucial because it guides the treatment plan. There are several ways doctors can collect these tissue samples, depending on where the tumor is located and your overall health. One common method is a cord-guided needle biopsy. In this procedure, a thin needle is inserted through your chest wall into the lung, guided by computed tomography imaging. It's usually done under local anesthesia, meaning you stay awake but the area is numbed. The procedure is quick, and recovery is typically short, often just a few hours. Another approach is bronchoscopy. During this procedure, a flexible tube with a tiny camera, called a bronchoscope, is inserted through your nose or mouth into your airways. The doctor can then see inside your lungs and collect tissue or cells by brushing or washing the area. Sometimes, a needle is used through the bronchoscope to sample deeper or less accessible areas. Bronchoscopy is often performed under sedation, so you might feel relaxed or sleepy. For more difficult-to-reach lymph nodes or lesions, doctors might use transbronchial needle aspiration, which involves ultrasound guidance through the bronchoscope. This minimally invasive method allows sampling of areas that are hard to access with other techniques. In some cases, especially if other methods don't provide enough tissue or if more detailed analysis is needed, a surgical biopsy might be performed. Video-assisted thoracic surgery involves small incisions in the chest, where a camera and surgical tools are inserted to remove tissue samples or even the entire tumor if possible. While more invasive, this method provides larger tissue samples, which can be very helpful for detailed analysis. Once the tissue is obtained, it is examined by a pathologist who looks for cancer cells and determines the cancer type. Modern techniques also allow for molecular testing on these samples. This testing can identify genetic mutations or markers that help tailor personalized treatments, making sure you get the most effective therapy based on your specific cancer. Sometimes, if initial biopsies are inconclusive or if further genetic information is needed later, doctors might perform repeat biopsies or blood tests called liquid biopsies. These tests detect tumor DNA circulating in your blood, providing additional information without needing another tissue sample. The goal is to use the least invasive method that still provides enough tissue for an accurate diagnosis and molecular profiling. This approach aligns with current medical standards and ensures your diagnosis is both precise and timely. Remember, it's important to discuss all your biopsy options, understand the risks, and talk with your healthcare team about what the results mean for your lung health. Always seek personalized medical advice to make the best decisions for your situation.